How does an HSG test reveal your fallopian tube anatomy? Imagine getting a detailed map of your reproductive system without surgery. That's what a hysterosalpingogram, or HSG, does. It's a special X-ray test used mainly to look at the shape of your uterus and see if your fallopian tubes are open. This test is often part of fertility assessments when couples are having trouble conceiving. It helps doctors understand if blockages or abnormalities might be preventing pregnancy. During the procedure, a small amount of contrast dye is gently inserted through your cervix into your uterus. This dye is safe and designed to be visible on X-ray images. As the dye flows from the uterus into the fallopian tubes, real-time X-ray imaging, called fluoroscopy, tracks its movement. This allows your doctor to see the exact path of the dye and how your reproductive organs are structured. If your fallopian tubes are open, the dye will pass through them easily and spill out into the pelvic cavity. This shows that the tubes are not blocked and that sperm and eggs can meet. If the dye doesn't go through or stops at a certain point, it indicates a blockage or narrowing. Blockages can be caused by infections, previous surgeries, endometriosis, or other conditions that create scar tissue or adhesions. The HSG also shows the three main parts of the fallopian tubes: the isthmus, which is closest to the uterus, the ampulla, the widest part where fertilization usually happens, and the infundibulum, which ends in finger-like fimbriae that help catch the egg after ovulation. Any irregularities, such as scarring or unusual shapes, can be seen during the test. These details help doctors decide on the best treatment, whether that's surgery to remove blockages or moving forward with assisted reproductive techniques like in vitro fertilization. It's important to remember that while an HSG is excellent for checking if the tubes are open and for viewing the uterine shape, it doesn't diagnose endometriosis directly. Endometriosis involves tissue growth outside the uterus, which often requires other tests like laparoscopy for confirmation. The HSG is generally safe, but it should always be performed by trained healthcare professionals to ensure accurate results and proper follow-up care. If you're experiencing fertility issues, talking with your doctor about whether an HSG is right for you can provide valuable insights into your reproductive health.